This is part 2 of our brief intro to med risk maps from Surveyor Health. Again, we're logged into an account. We've chosen a patient record, Sarah Oberheim, a 56-year-old type 2 diabetic who's presenting with numbness and chest pain. We've looked and searched her risk landscape and identified that these symptoms are correlated very significantly with her additive side effect risks, but not at all with her interactions and very little with contraindications. Let's see what we can do to resolve these problems. I've opened up the additive side effects, and since we've identified that Zomig is the primary contributor, we can actually speak with the patient, Sarah, and confirm that she's actually taking Zomig. Assuming she is, what we want to do is find a suitable substitute. So we're going to put our cursor over the edit link and do a simulate impact of an alternate medication, looking for another med that can reduce her problems. There are 4 ways that we can select a set of candidates. We can do so based on condition. That is, show us and consider all those meds that are indicated as therapy for the condition, migraine headaches, that she's taking her present Zomig ZMT oral for. Now, these meds may be on-label or off-label, in class or out of class, but all indicated as therapy for this condition. We may also look at candidates based on the same drug therapeutic class or classes that Zomig ZMT belongs to, and that preserves a level of clinical efficacy that the current medication Zomig has. We can do so based on a reference list. So you can create these reference lists yourself. In this case, in my account, I've got reference folders, for example, comparisons. Here's a med list comparison of migraine meds and rheumatoid arthritis meds. And you can go that way to customize it. Or if you know exactly what you'd like to try out, you can search it. I'm going to go the route of the drug therapeutic class, and therefore consider all meds that will be similarly efficacious to the current med. So what do we have here? If we scroll down, we see we've got 26 meds that are in the same therapeutic class. Let's go ahead and save a bit of direct expense while we're looking at a substitute med by specifying a generic therapeutic equivalent. Well, that's cut this med list down to 10 substitutes or alternates. I'm going to select all of them, and let's now compare them side by side with the patient's current Zomig with respect to the patient's problems to provide us with decision support on a superior med for use in this clinical encounter. So here we've got a special information heat map visualization. Here's her present Zomig. Here are the other problems that she has correlated with numbness and chest pain. And as we scan across, we see there's one med in particular, zolmitriptan nasal, that has no reported risk of critical chest pain, no reported risk of critical numbness and tingling. There is a trade-off, however, because there's a small risk of minor numbness and tingling. But that may well be an acceptable trade-off. Let's go ahead and select it as an alternate, confirm it as the replacement, and the system is going to ask us how we're intending on using this. This is going to be used for treating migraines. Finish the simulation. So now the system is figuring out what's the impact going to be if we swap out the Zomig for the zolmitriptan nasal. Will this actually help Sarah with her problems of numbness and chest pain? So now we get a new result, and it looks like those risks are lower, but let's get a before and after picture. I'll come up here and click on deltas, and this will give us that before and after picture. So, take a look at the before regimen. Just to document it, I'll go ahead and open up and expand the before regimen, and there it is as we started with the Zomig oral in place. We don't need to see all the column details at this point. Then we've got the changes. Here we see that Zomig ZMT has been temporarily discontinued and zolmitriptan nasal has been added as a proposed med, and the risks of those two meds. Lastly, we look at the resulting regimen, and there it is with the zolmitriptan replacing the Zomig. Again, I can collapse that regimen, and we see we've achieved a very substantial reduction in the risk of her presenting problems, from up to 25% risk to no more than 10. We also see that we have increased by this change minor numbness and tingling. Now, when we look here down at interactions, we see that this change has not created any additional drug interactions. They're the very same before and after. So making this change will not do any harm for the patient in regard to drug interactions. Similarly, if we look at contraindications, the contraindications are very identical between the before regimen and the after regimen. So again, we're not going to do harm. Lastly, up in additive side effects, you notice that trends say there's 9 risks that are going up while 20 are going down. Let's actually take a look at those increases in risk. So here are all of the increases, the particular symptoms that may increase in risk as a result of this change. So while we're helping Sarah out with her numbness and tingling and chest pain, we may cause her an exacerbation of her risk of minor stomach cramps. That's of concern, so we'll go ahead and check it and manage it in the system. Similarly, chest tightness is increasing, very small, but it's a critical form of chest tightness. We want to monitor that. Similar to critical throat pain, we also want to monitor that. And this can be used to generate a custom report for the patient, letting them know exactly what they need to monitor, be aware of, and to contact the prescriber or the pharmacist in the event that these problems develop. So, all told, that's a quick view of medication risk maps. In part 1 of the brief demo, we saw how to identify and diagnose them, and now in this part 2, we saw how to mitigate and resolve those. Please try it for yourself at surveyorhealth.com, where you can create your own accounts and enter patient data or bring them over from the personal health records such as HealthVault. Thank you.